Today's show is on sports psychology and the principles to achieve peak performance. This podcast has been developed with the intent to inform and educate the general public and providers and should not be relied upon for any other purpose. The content, views, and opinions expressed in this podcast are those of the speaker and not those of the San Diego Psychological Association. Welcome to the San Diego Psychological Association's podcast, Diving into Healing. I'm your host, Dr. Michelle Carcel. I'm happy to introduce Dr. Dr Saleh, clinical psychologist working in group practice, which specializes in treating university students. He received his undergraduate degree from Emory University and his master's and doctorate degree in clinical psychology from Alliant International University. Welcome, Dr. Saleh, and thank you so much for being on the show.
You're welcome, Michelle. Thank you so much for having me.
I'm really happy to talk about this because this is a facet of psychology that not a lot of people really know about. Typically when we think of psychology, it follows more of a medical model where we're thinking about healing and, people who are having symptoms like depression and things happen in their lives, anxiety, things that they need help with. And, they come in thinking of a mental health provider in that way. Whereas sports psychology takes a different approach. And I think it can be really exciting for people in all facets of life to get this information. And I'm curious for you, given the background in clinical psychology, how did you learn about sports and performance psychology?
So that's a great question. And it really wasn't all that long ago. It was really only about 10 years ago. So growing up, a little more background about me. I was a competitive athlete all growing up, played baseball and soccer. And, I put a tremendous amount of pressure on myself to perform. And, sometimes it was helpful. Sometimes it wasn't. And at the time, about 10 years ago, there wasn't a lot of talk about, stress, performance anxiety being okay and a natural kind of part of sport. So I ended up playing baseball at Emory University. It's a Division III college. And, as my baseball skills increased, so did my levels of anxiety. Looking back, I really wished I had known more about sports psychology and mental health treatment for athletes. Looking back, I can't recall any of my teammates, ever talking about mental health or seeing a mental health professional. So it really wasn't until I started my doctoral program at Alliant in 2012, where I was hearing more and more about, mostly individual sport athletes, tennis players, golfers, talking about this breaking new field, like you mentioned. And from there, it was a natural combination. It seemed very natural to combine my love and passion for sports with my high degree of interest and passion for mental health and healing. My advisor was willing to advise my research on the psychological impact of serious injuries on elite athletes. And I just kind of started learning more, going to conferences, reaching out to people in the field, doing things like that.
That's wonderful. And because sports psychology is a newer division of psychology in general, not a lot of people are familiar. So it's good for us to talk about this. And I'm curious because, the focus, given the name itself, right? Sports psychology, the first thing that comes to mind are athletes, people who are really taking advantage of sports, whether in a professional manner or in academic or scholastic ways, college and what have you. But I'm curious, what about the average person like myself, who is looking to be healthy, who may lack some motivation, may, just need some guidance? How does sports psychology help them?
I think it's a great question, and I talk about often performance is included. Some professionals will market themselves as sport and performance psychologists, and the theory is that these psychological skills can be applied to any type of person who is going through a great deal of preparation for a small window, very short period of evaluation. So I absolutely think sport and performance psychology is not only being used in the sports realm. We're starting to see some principles also being used in businesses, and people seem to really be resonating with the fact that performance naturally brings up pressure, and it teaches people ways to recognize that everything we have is still within us. It's just the situation that is changing. We kind of create the stakes. Whereas if we strip things down, we realize at the end of the day that in that moment we trust the preparation that we've built up over time. We try to discourage people from trying anything they haven't tried, trying to be a hero,
Hmm.
things like that, to stay within ourselves, to stay focused on what we know to be true and what we've prepared for.
Right. And when it comes to this, the research is really growing in this field. I was reading a little bit of research on this specifically, and that the major objectives tend to be, and feel free to correct me here, but from what I've read, is to understand the psychological factors that impact a person's physical performance, but also to understand how a person participating in sports, how that influences them, and the stuff that is maybe behind the scenes mentally that could be hindering their success. So it's really cool how it's a multifaceted discipline in that way, where we're still keeping the mental health piece at the forefront,
Mhm.
and we're integrating a lot of really structured things to help achieve goals. Do you agree with that?
Absolutely. And sometimes we can use psychological principles without people even really knowing. So it's a great way to connect mental skills with the things that we all already love to optimize performance. So you hear a lot of sports psychologists and other certified mental performance consultants. This is a newer certification through the Association for Applied Sports Psychology. And they talk a lot about mindfulness, a lot about being right where your feet are. Breathing is huge. People often think, whether it's for a big game or if it's for a big presentation, that you have to get pumped up. The idea with sports psychology is that the quieter our minds are, the quieter our bodies are, the better we'll perform. Because that kind of the rah style actually can add some more tension. And as we know, there's a fight or flight response that get more tense. Our heart starts beating. We're not thinking as clearly. And another huge thing I want to add is imagery. The belief that by just imagining, or the theory is that by imagining ourselves succeeding in a moment, for example, like gymnasts, mentally rehearsing the exact event, having hearing the music, imagining the feel of the mat, calling the routine, it actually exercises our motor cortex, which, as we know, is involved when we're actually doing movements. So this actually activates that part of our brain to prepare us for what we're preparing for.
Yeah. I love what you just said too, because as somebody who doesn't specialize in sports psychology, but I'm a huge fan, I'm used to seeing the media portray, the concept of athletic endeavors and goals and stuff like that, and watching shows of like the big game, so to speak. And we see the rah, like you just described, really aggressive, sometimes bordering like almost too much to maybe like make this goal happen, winning the game, so to speak, or being at our peak performance. But I love the fact that you just described that it's actually not the case, that we do need to activate that part of the brain, that parasympathetic system, to really engage to help us calm ourselves. Sometimes I often like watching the Olympics. I don't know if you're a fan, but I watch the Olympics sometimes, and
Absolutely.
yeah, I find it so amazing to see that these are athletes that for a split second, of their life, it could determine being on a podium or not. And I'm always fascinated at watching right before they start. And many of them just take a big inhale and exhale right before they're getting ready to perform. And I think about that activation of the parasympathetic and that mindful moment that we all love to see an athlete do.
Yes.
And, yeah, I love that you're really talking to that right now, and how important and significant,
Hmm.
mindfulness is, along with other strategies. And I'm curious, can you talk more to strategy? That I think that might be helpful for people just trying to understand what it is that they would learn from you or someone like you, coming in, whether it's if you're an athlete or whether it's somebody who wants to achieve,
Mhm.
a better, healthier life?
Yeah. No, are you talking in kind of like in the competitive realm, kind of just in general?
Either, yeah, competitive and also the average person, myself, like thinking of
Mhm.
mindfulness. What other skills would you recommend?
Got it. So one of the things I'm glad that you brought up the Olympics, because the Olympics was one of the major organizations that really did adopt sports psychology and started hiring sports psychologists. With the Olympics, so there's that famous shot of Michael Phelps. It's like you said, right before a major event. I forget which one exactly, and he's got his headphones in and he is just locked in. He's almost like this intense, intense. So, pre-performance routine, it primes our mind and body to perform. And I think that any type of pre-performance routine, it's the intention behind it. So whether you're at the Olympic level, or like, Michelle, if you were going out just to lift weights at the gym, whatever type of exercise that you prefer to do. The intention, setting really clear goals of, why am I doing this? There's a famous quote. I'm going to go with what the actual quote is, by Nietzsche, who is, he who has a why, and of course we can substitute she or they, who have a why can bear almost any how. So keeping that in mind, that if the value is health, we tend to build our behavior around that value, as long as it's really important to us. So we always have to keep the why stronger than the what or the how am I going to do this. That's a huge thing that I talk about, both with performers and with my clients, with everyday people, just like you and me.
Wonderful. I love that. It's so true, isn't it? It resonates so deep. When you're talking to people too, I'm curious, how do you apply this or these conceptualizations, these theories, these practices and skills to helping people achieve their performance goals? How is it applied?
That's a great question. So there's a myth, especially in American sports, where we see elite athletes being put up on pedestals. They're almost, these demigods that we think are just indestructible, who let, criticism just roll off their shoulders, let whatever else is going on in their lives just roll off their shoulders, and that's just not the case. To really connect with any athlete, you have to show that you care about them as a person first. So my clinical training in humanistic psychology, and that humanistic approach has been really, really helpful to, just look for their essential goodness, their need for human connection, their need for support, validation if they have a bad game. So we really have to tap into people's humanity. I got another quote by Theodore Roosevelt, and I actually heard it through a man named Dr. Ken Ravizza, who passed away a couple of years ago. So rest in peace to Ken. So I actually heard the quote through him. So it's that people don't care how much you know until they know that you care, and that really resonated with me. So doing things like, before a presentation, I've done some work with high school teams. We would do something as simple as icebreakers. So I would ask for their initials, and it'd come up with a funny name, and so it was a
Mhm.
girls basketball team. It got the girls laughing, and it just,
Mhm.
they seemed to be more receptive to what I had to say, once you can help people let their guard down.
I couldn't agree more. I was talking to somebody recently, and when it comes to clinical psychology, a lot of times there's these old stigmas, these old things and conceptualizations of how we do things that is not actually accurate. And that's where it's good for us to talk about the human experience in therapy. The human experience in sports psychology, clinical psychology, and all facets of mental health, where it is that connection, that therapeutic alliance, and that we feel that connection. Because without that, we don't get very far anyway, whether it's in life or in our field, in mental health, or in general. So I'm glad that you said that, and I love your quotes. I'm making mental notes to to write these down later because they're great. And yeah, they're very true.
Thank you. Yeah, I wish I coined them, but
Well, as you do this, you may actually invent one
Maybe
of
I'll come out with some soon.
I was gonna say you'll probably invent one of your
Yeah,
own.
who knows? Yeah.
Makes a lot of sense. I am curious, because, like I was saying earlier, we are trying to get information out to the public and really giving an opportunity to people to learn more about what mental health really is and what can be expected coming into an office with whether yourself or myself or another mental health provider. And while it is different, each person is coming in with different symptoms, different ailments, different goals, different aspirations. There's still a process, there's still a very human experience to this that it's important that we address. And again, I like talking about that therapeutic alliance, meaning that you're working with your clients in a human level. You're really looking at them individually, and that is in essence what we do. We look at people, individually. We know conceptually there are things that we need to be looking out for, and we make sure that we custom tailor what we do for our clients.
Mhm.
And in sports psychology, it's really neat because, we're not necessarily, looking at, symptoms that are hindering their life. We're looking at symptoms that are hindering their goals for what they want to achieve in a sports arena or a sports world or, health wise, right? So this is really a wonderful part of psychology. And I'm curious, how are you helping educate people about this field since it's a newer field and it's branching out?
There's a lot of work to be done, and it's slowly gaining a foothold. So, I was nominated by my mentor, Dr. Shira Oretsky, to take over her role as San Diego Psychological Association's Sports Psychology Committee, along with my co-chair, Dr. Kimberly Wagner. So during this time, we're just starting to build it up. One of the things we're doing, so we put together a webinar training that we opened up to all of San Diego Psych Association, and we had a wonderful turnout. From there, we were able to identify a couple people, mostly graduate students, who were interested in joining the committee. I think that's where it's really important to start reaching out to the up and coming professionals who are still students, who are looking for opportunities to spread the word about sports psychology. When I was a graduate student, for example, I was happy to do pro bono work with my former high school and some of their coaches and teams. So it's really important to let people know in graduate school that that this is a possibility. So other things we've done, and then just recently, one of our goals is to kind of do live interviews similar to what we're doing now. Just recently, with a former college teammate of mine at Emory, we interviewed, and it was educational. We asked him about the ethical side of sports psychology and confidentiality, like you mentioned. Like, when do mental skills get into the clinical realm? So the field is really trying to identify that line of at what point there's this continuum of needs based on severity of symptoms. So the field is really working very hard to make this as clear as possible and to really set some guidelines for how we can implement mental skills and sports psychology into almost just seamlessly as a part of teams and individual athletes and everyday people's
Mhm.
their everyday
Yeah.
experiences.
You brought something up that I think is really important for us to talk about. There's a certain types of personalities that go into certain types of careers, and we have personality assessments for this very reason. Most people have, done some of these online, and some of them in more formal settings. And there's we call it the type A type, the more current type of personality trait, but there's also something that I think is important that we address, which is what you were discussing, kind of, teasing out the, folks who have, more of this driven style of being and that they're really excited about what they're doing and really participating in sports in a very healthy way, which is a lot of people. And then there's the part where, we're talking about the Olympics and you brought up Michael Phelps, and I could not applaud him more for coming out and talking about his depression and the things that he was suffering from all throughout his career on and off. And, that it really impacted him, and that the need for, having a distinction in some way, whether it's coaching or doing, working with a sports psychologist, but making sure that we're also keeping an eye out for things like major depression, like anxiety disorders, and one that I specialize in, which is eating disorders, and also I specialize in trauma. So, that we're keeping an eye out
Hmm.
for, and this is good for parents to know. This is good for, athletes to know. And I think it's really important that you and I can talk about this,
Totally
that
agree.
if they've got stuff going on, you don't have to push through it. You don't have to fight this alone, that there are providers like you, like me, like many, many others, that we're here not just to help enhance the goals, but we're here to help peel away and work with, what's there that's hurting, harming, causing pain. And it can be done conjunctively in many ways. Do you agree with that?
I totally agree. And I think for athletes and everyday people, I think athletes are everyday people as well. As I was hearing you talk, it brought me to authenticity, that fearless drive to for our goals, our behaviors, and our thoughts and feelings to align and to take that risk to be ourselves, just like somebody who might be forcing a job to work, or whose parents expect them to be a doctor, for example. Athletes can go through very similar things. They want to live up to expectations. They were the top recruit in the nation, and they feel like they have to go to the top college and they have to go into the pros. It's called identity foreclosure, that our identity becomes wrapped up in our physical abilities or our work. A lot of people, when you first meet somebody, they ask, what do you do, rather than what do you love? And if somebody says, I love psychology, well, great. But I notice that we often lead with that. So I think it sets this precedent that we need to focus on the individual, and the person who wants to perform their best. The more they are in touch with their authentic self, I think that's one of the keys to optimal performance.
I agree. I think, when it comes to any type of task, but especially one that requires mental and physical, a mind body connection, a mental and physical approach, it's so important that we know ourselves, right? To a level where we've peeled away, kind of, I always like to use the term with my clients, peeling the onion. I kind of I reference Shrek
I like that.
that. Yeah, you're peeling the onion, you're going deep, and sometimes you're gonna cry. It's probably a lot of times, because we all have stuff.
Yeah. Yeah.
We all have stuff underneath that is, preconceived things that we've learned from childhood, preconceived notions. And, when it comes to performance, a lot of times those things can actually hinder us and cause us to not be our most efficacious, not to be at our own best, whatever that looks like. So yeah, that's why I think it's really good that we're talking about that melding of,
Absolutely.
not just, hey, go do this, you're good at this. This is, something you've polished yourself to do in achieving these goals in sports, or health or what have you. It's also that connection to who the authentic self is, and who you are, and how you want to be, and why are you even doing this?
Yes.
Like, what is the intention really for the person, which can be really cool.
Absolutely. And sports is a game of failure. Our games and competitions of failure. It is inevitable. No matter how much we want to deny it, there's going to be a loser. you know, for example, just a little side note. Baseball, the sport that I know best, is if you're getting on base 3 out of 10 times in the major leagues, you're going to be in an argument to be a Hall of Famer. So they're failing 7 out of 10 times, and they're still being regarded as these stars, these legends. So if we identify so much with our physical performance, and we're inherently engaging in an activity where failure is inevitable, it's going to be really hard on our mental health. like you said, like we get these preconceived notions about, failure is bad. There's a sports psychologist, Michael Gervais, who talks about, fail forward. Another, I can't remember who it was, but seeing failure as feedback as opposed to I'm a failure. It's like I failed, uh, however, I am not a failure.
Yeah, I love that. I am taking so many mental notes and I can't wait to apply this because, we don't think about it that way. Conceptually, we do end up having to have to make mistakes in order to learn from that. And in sports, you're bringing up statistics that are absolutely accurate where you're going to have to fail in order to learn and succeed. And, I think this speaks a lot to just our general population.
Hmm.
And especially, I know you work a lot with students, and I work with students as well, especially in a university setting. And boy, there is just so much pressure these days to perform, whether it's academically, whether it's athletically,
Yes.
whether it's, in any kind
Yes.
of context. Personally, I don't remember being under that much stress. I don't know. Maybe maybe I just ignored it. But
Hmm.
this is really scary in a way, in a lot of ways actually, because this isn't real life. Real life is about exactly what you just said. It's about, falling 7 out of 10 times and knowing how to pick yourself up and be grateful and happy and proud and still know that you're still at the top of your game even though you've had more of these failing forward moments. I hope I'm saying that right.
Hmm.
But
Yeah, great application of it.
oh, good. I'm learning from you. That's wonderful. I really appreciate this, and I this is why I think, sports psychology as a newer branch of, psychology that is becoming more known is so helpful because it not only helps people with, their goals in this way, but it also applies, like you said, in business, in life, parenting, school, every which way. So, yeah, this
Hmm.
is really good. So I'm glad to hear how influential your work is and what you're helping students do. I think it's awesome.
Yeah, thank you. I really appreciate it. That's my one goal in life is to help as many people as possible while looking out for myself as well. But if at the end of my career I can look back and say, I did what I could to reach people in creative, unique, authentic ways, then I'll be a valued life, a life well lived.
So, we're talking about, the mental abilities here when it comes to, being in the game and, in the moment. I think it's important for us to address how does somebody who's in the moment, let's say it's baseball, for example, or football, or they're in their competitive zone, but they're not doing well. It's not going their way. They're struggling. It could be something that affects them and also affects their team if they're part of a team. How do you come back from that, or what do you recommend as a skill set or interventions that can help them, come back in and do their best? Because we're talking a little bit about failure, but we also want to make sure that, people who are in that state, which again can happen more often than winning, how do they pull out of it?
So that's a great question, and coincidentally, those are the two sports that I was going to use as examples. So one of the things that mental skills coaches and sports psychologists will recommend is coming up with some type of physical cue, like some type of reset. So there was he's currently in the NFL, and what he learned to do is on his tape. He has they tape a lot of athletes will tape up their wrists. He put a big red circle. Anytime that if he dropped a pass, if he ran the wrong route, he would take a look down and almost press it. And it was his physical cue to okay, this is a reset. What just happened is gone. Baseball, another one. It's the so there's always a little bit of time in sports. Even a fast-paced sport, soccer, hockey. There's little timeouts. There's little moments. So it's like really appreciating those little moments of time in between the action. So another thing that baseball players will do and softball players are encouraged to do is find some type of physical object to ground in. So when a guy or a gal steps out of the plate, they'll they'll like look at a spot on their bat. You might, if you look closely, actually, when the when the Padres come back on and hopefully take us to the promised land, they'll take a deep breath and they'll focus on just one label of the bat. Doing that each time is just a reset. And teammates, buy-in to sports psychology and mental skills is huge. So using our teammates for support. If mental skills and encouragement and motivation comes from teammates, I mean that is 100% preferred. Athletes hear enough from their coaches and trainers, and there's a certain uniqueness and there's a certain power to teammates who are also willing to just step in, take ownership. Morale is real. We humans naturally pick up on electromagnetic signals that we give off. So morale, really, it's a neurological activity involved. So, just something as simple as a pat on the back. Somebody strikes out, just an arm around the shoulder, something like that. It really, really goes a long way.
Hmm. I'm glad you brought that up because one of the biggest things that we see and that's founded in research is one of the biggest factors that affects people with depression, people that have anxiety, people that are experiencing these symptoms. A lot of it's isolation. Not all of it, of course, but there's a big component of what we see with people who are struggling. They feel alone, and having a team, having camaraderie, having a purpose.
Yes.
And that way, even if, the team doesn't win, you're still bonding and you're still helping each other and knowing that that's normal, right? That's life. We don't win in life,
Yes.
you know, all the time. As a matter of fact, we need to lose, as we just said, to in order to gain and grow.
Right.
Um, so yeah, team sports can be a wonderful way to do that, and I think it's good that we, talk a little bit about that for anyone who might be feeling alone, who might be feeling isolated, and they have opportunities maybe at their school or some work environments. I know with COVID and the pandemic, it's been really difficult because that's wow, this year's been just so hard, and we've all been isolated, and that's been so difficult. So now, as we start hopefully coming more back to life and back to normal, that we can resume these very important, special, we'll say traditions of sports, and team camaraderie, because it really does help.
Yes, yes, and that camaraderie, it brings you back to the values again. Like you said, we can't guarantee we could do everything right and still lose a game. So if we put the value on the outcome, we're setting ourselves up for disappointment. So the value, if we can look at the value after loss of, really looking ourselves in the mirror and say, did I do everything I possibly could? You know,
Hmm.
did I do everything I possibly could to help my team win? That's what's important at the end of the day. And it's the realization and the acceptance that nothing is guaranteed. A win is not guaranteed. The only thing we can do is put ourselves in the best position possible to succeed. And when the moment comes, we just flow. We go all in, and we go in with our hearts and minds. That's what we have. Can't control what happens to our environment. All we have control of it is how we react to our environment. So making that very clear to athletes, and the fact that if you fail, again, you're not a failure.
Hmm.
Actions don't define our
Hmm.
identity.
Yeah. I was just going to add that, I don't even personally believe in the word failure. It's just a word that to me, I know it's an important word. I don't want to disregard it or invalidate it. It's life lessons here. Life is not meant to be about necessarily winning or losing as much as it's about achievement and performance and getting to that and winning. Yes, of course, there is a goal. We've actually structured it this way, so that's good. But like you said, it's not always about the win. It's about what did I learn here, and that really is the most important thing, in so many ways. And at least in my opinion, of course. But I think we can learn so much from the moments that are not quote unquote the wins in life.
That made me think. I'm curious. What word do you replace failure with, or what would you recommend? What have you noticed resonates with people
Yeah.
as opposed to, yeah, failure?
Yeah, for me personally, I identify the word. I think it's important that we acknowledge the word failure because it is something that we all are familiar with. We all know what that feels like to some degree. We've learned this from many ways. I mean, even the way that we are in grade school, our papers are sometimes it's -2 out of whatever. So right there we're seeing what we missed on the exam or on the test or whatever versus positive whatever, right? So there's just a reality where we're constantly shown where we're missing. And I think if you look at this from an evolutionary perspective, you know, it's life is just about learning. We're about learning,
Yeah.
and our environments procure so much of how we take in information, and there are patterns that we all can share to some degree. We're still individuals, absolutely, and we have to be looked at as individuals, and that's definitely important. And that we also are pack animals, and that there are things that, if we can look at something like, "Oh, I know I messed this up, and what did I learn from it? What can I gain from this quote unquote failure? And how can I do better?"
Mm.
And not beat ourselves up, right? This becomes a really big challenge for people who have a trauma history. This becomes a really big challenge for people with depression or people who have symptoms of anxiety. It's hard because there's an internalization, right? And I'm sure you've seen this, especially with students. It's a developmental piece as well, but it transcends. It goes from all the way up to late adulthood.
Mhm.
But yeah, for me personally, I acknowledge the word, and personally, I just don't buy it. It's to me, failure means stopping, achieving, giving up. And even then I get it. Even then we can acknowledge that there's a reason behind that too, or reasons. So that's just my own take on it. But I'm definitely not a sports psychologist, so don't quote me.
I might have to. Yeah, I really like that. But I'll respect whatever you're comfortable with. No, I
Yeah.
think that's great. I mean, in acceptance and commitment therapy, developers of the theory talk about our relationship with the words that we use. Our words really do hold an impact, and if we're not mindful of it, our brains are still hearing these words, whether it's being told by somebody else or it's coming from our own mind. The brain is constantly processing stimuli, whether it's internal or external. So I think you make a great point there that sometimes people just don't have the wording because it's just so ingrained. Like, I mean, failure is all around, right? We hear it. We've been hearing it, failing in tests, like you said, on the papers. So it's just become such the opposite of success when really it is an opportunity to learn at the end of the day. And we have to choose if we want to learn from it as well. Like you said, you can't fail if you don't quit.
And again, it's all subjective, right? So, everybody's unique. And I think, as mental health clinicians and practitioners, our job is to get to know our clients as much as possible and to meet them, as you said earlier, where they're at, and to make sure that we are taking into account the level, whether it's symptomology or history or whatever it is that's impacting, and incorporating that into their goals, their treatment plan, whatever it is that is specific to what they're coming in for. And I think sports psychology, what I love about what we're talking about today is it's just such a beautiful melding of the clinical and the medical model, which in many ways has been criticized by folks who are in positive psychology, and which sports psychology also does. We're looking at strengths. We're looking at people's strengths, and everything from wording, everything from the thoughts, the behaviors, the actions. If we're thinking about cognitive behavioral work, there's just so much good stuff when we incorporate that positive aspect of what sports psychology and positive psychology can bring into this medical model and clinical model. So yeah, I just think it's a really neat thing, and I'm so glad that you're talking to this and that you've been willing to share so much with us today. I do have a closing question for you. I'm
Sure.
curious, given that, yeah, given that sports psychology is, newer, in some ways, a lot of people aren't necessarily as familiar as clinical or just, mental health providers in general. How does one go about finding a sports and
Mhm.
performance professional to work with like yourself?
A couple different places. So a great place to start would be San Diego Sports Psychology Associates website. So it is comprised of a group of sports psychologists and certified mental performance consultants. Um, I think I briefly brought up who are certified by the Association for Applied Sports Psychology. That's one great place to look. It's a group of local. I think I mentioned they're local sports psychologists and mental health practitioners. You can also set a filter on SDPA's directory or Psychology Today's in their Find a Therapist tab, and you can search exclusively for people with specialties in sport and performance.
Wonderful. Well, thank you so much for that. I'm curious, for anyone who's listening, how would they go about finding you directly?
Probably email is the best place to reach me. I'm starting to build up a bit of a social media presence, but I think it's still a little minimal at this point. So I'm happy to share that once I can get a little more content out there. But the best place to email me is Michael period Saleh. It's spelled Saleh, followed by the number 7 at gmail.com.
Well, thank you so much, Dr. Saleh. We really appreciate you being here. I think this topic is so incredibly important and so helpful. I enjoyed talking with you. I think we covered quite a bit here. Is there anything that you'd like to end with or share with our listeners?
I really appreciate you bringing this field to light. It takes people like people in other disciplines of psychology, other fields to start to talk about it. I can't do it alone. My mentor is Shira Oretsky, my co-chair Kimberly Wagner. We can't do this alone. So it really takes buy-in and looking at the value of it. If you're a parent, you might have a child who is struggling, and going to a traditional therapist or counselor might hold some stigma for certain people. So just really want to thank you for helping me spread the word about psychology and letting athletes know that there is an option out there. There are a lot of former athletes became sports psychologists and certified mental performance counselors. So I think we have that unique insight, and never presume to know exactly what people are going through. We can relate. We can relate on some level. So I very much appreciate you having me on today.
Thank you. We appreciate your time, and I will definitely take some of this material and incorporate it because I thought it was just so insightful. So, thanks again for being here with us.
Sounds great. Thank you so much.
The information and advice offered is not intended to treat or diagnose and is not meant to replace any other professional consultation. If you'd like to know more about the San Diego Psychological Association, go to our website at sdpsych.org. That's sdpsych.org. Thank you so much for tuning in. Until next time, take care of yourself and be well.